Hey everyone, and welcome to, this is going to be a fascinating deep dive all about neurosurgery. We're really zeroing in on what conditions neurosurgeons actually deal with. Someone you know who you are wanted to know more. And lucky for us, Dr. Katsevman actually put out this really interesting article. It's been eye-opening, to say the least, way beyond just brain surgery, which is what I kind of thought we'd be talking about.
It really is amazing how many different symptoms, even ones that seem totally unrelated, can actually be traced back to your brain or your spine, like it's all connected.
That's what I thought was so wild. I mean, Dr. Katzman's list of conditions includes carpal tunnel, even bladder problems, and I never would have guessed those were neurosurgery territory.
Right. It all comes back to those nerves, those pathways.
Mm.
But okay, let's start at the top, literally, with the head. Now, I think when most people think brain surgery, things like brain tumors come to mind.
Yeah.
Right. And those are definitely in the mix here. Along with hydrocephalus, that's when fluid builds up in the brain, and aneurysms, which are those weak spots in blood vessels that can be super dangerous.
And I'd imagine those can cause some pretty noticeable, pretty serious symptoms.
Oh, absolutely. But here's something I thought was super interesting from the article. Dr. Katzman talks about how the location of a tumor in the brain can actually determine which of your senses are impacted. So, like, you could have one tumor affecting your sense of smell, another one messing with your vision, all because of exactly where they are on that nervous system map.
Wow. So even within the brain itself, location is everything. And it really highlights how those things we might not automatically associate with the brain, like headaches, dizziness, even just having trouble with the memory or balance, those can all be signs, clues that something's up and might even need a neurosurgeon to take a look.
Exactly. It's all about connecting those dots. And speaking of connections, let's move down literally to the neck. Now, neck pain, herniated discs, that kind of thing, I think most people can wrap their heads around those being neurosurgery related, right? But here's where it gets really wild. Problems in the neck don't always stay in your neck.
Okay, now you've got my attention. What do you mean?
Think about it. The nerves that run from your spine, they go down your arms, right? So say you've got a pinched nerve in your neck, maybe from a herniated disc that can cause shooting pain all the way down to your hand. It can even lead to weakness, clumsiness, like suddenly you're fumbling with buttons or can't write properly.
Hold on. Are you saying something as simple as, like, struggling to type an email could be linked to my neck?
You'd be surprised. It's more common than you'd think, and this is where that whole detective work thing comes in. Dr. Katsevman even talks about carpal tunnel syndrome, which I think a lot of people associate with just like repetitive motions. But really, it's that narrow passageway in your wrist, the carpal tunnel, putting pressure on a nerve. That's why you get that numbness, the tingling, especially at night.
Okay. So if you're getting any of those weird feelings in your arms or hands, maybe time to look beyond just the obvious culprits, right?
Exactly. It's all about tracing those symptoms back to the root cause, which could actually be in your spine. But we'll get to the back in a minute.
Okay. The back. Now, this is one where I feel like most people can make the connection to neurosurgery pretty easily, right? We're talking back pain, those herniated discs again, even scoliosis. Seems like a no-brainer, pun intended.
I see what you did there.
But seriously, those do seem like obvious cases. What I find so interesting, though, is how those back problems can actually show up in your legs. Dr. Katsevman talks about how things like sciatica, where you get that shooting pain down your leg, that can actually be traced back to what's happening in your spine.
Oh, for sure. Like imagine you've got a herniated disc in your lower back, right?
Yeah.
If that disc bulges out, which is basically what happens in a herniation, it can really press on the sciatic nerve. And that nerve, it runs all the way down your leg, so that pressure is what causes that super intense radiating pain.
So it's not even just your back itself that's hurting. It's like those pain signals are getting all messed up because of the nerves.
Right. That's it. And it's not just sciatica either. You can have weakness in your legs, trouble walking, even falling more often. All of those can be caused by pressure on the nerves in your back.
Wow, it's like this crazy domino effect. And, Dr. Katsevman even mentions things like leg cramps, needing to sit down all the time. Even those, he says, could be signs of a back problem. And those are such everyday things. I don't think people would automatically think, oh, I better go see a neurosurgeon.
I know, right? It's so easy to just brush those things off. He talks about something called spinal stenosis, which is basically where the spinal canal itself, so that's the pathway all those nerves travel through, it starts to narrow. Imagine squeezing a garden hose, you know? The
Uh-huh.
flow gets restricted, and it's the same idea with your nerves. They can't send those signals properly when there's all that pressure.
Yeah.
So, yeah, even those everyday symptoms can be a sign of something more serious going on.
It's just amazing to me how it's something we totally take for granted, our ability to just move around freely, how much it relies on this super complex system, the brain, the spine, all those nerves.
I know. It makes you realize how interconnected our bodies really are.
Yeah.
And, it all comes back to why getting the right diagnosis is so important.
Oh, absolutely. Speaking of connecting those dots, there was this one thing in the article that really threw me for a loop. Dr. Katsevman mentions foot drop.
Foot drop.
Yeah. And I was like, wait a minute, how is your foot connected to your back? It seems so strange.
I know what you mean. It does sound a little counterintuitive. But remember those nerves we were talking about? Well, foot drop, that thing where your foot kind of drags when you walk,
Mm-hmm.
that can actually be caused by a nerve being compressed in the lower back.
Mm-hmm.
Again, it's all about those signals not getting through properly.
So if you're experiencing that, it doesn't necessarily mean there's something wrong with your foot itself. It could be coming from way up in the spine.
Bingo. And honestly, that just shows you how incredibly skilled neurosurgeons have to be to make these diagnoses. Because they're not just looking at where the symptom is, they're tracing it back, like detectives of the nervous system.
It's mind-blowing. And you know what? We haven't even gotten to everything Dr. Katsevman covers in this article. He even mentions bladder and bowel problems as potentially being related to, get this, the brain or spine.
Right. It sounds crazy at first, but then when you think about it, those functions, they're controlled by nerves that branch out from the spinal cord, right? So if you've got problems in the spine that can mess with those signals, and bam, you've got incontinence, other issues.
Okay, you've officially blown my mind today. So what I'm hearing is neurosurgery, it's not just about the brain, it's about the whole nervous system and how a problem in one spot can show up in a totally different part of the body. It's amazing.
That's the crazy thing about the nervous system, right? It's all connected.
It's like our bodies are trying to tell us something, right? But we don't always know how to listen.
And that's where neurosurgeons come in. They're like the interpreters, the code breakers for
Yeah.
all those signals our nervous systems are sending.
Right. They're taking those cryptic messages, all those symptoms, and figuring out what's really going on.
And the really cool thing is our understanding of the nervous system, it's always evolving.
Right.
Every year, there are new discoveries, new treatments, new hope for people who are dealing with these really challenging conditions.
I can definitely say this whole deep dive has been a real eye-opener for me. Like, I'm going to be way more aware of any aches, pains, weird tingles, anything.
That's the perfect takeaway. It's so easy to just ignore those little things,
Yeah.
right? You get a nagging pain, a little numbness, you figure, oh, it'll go away. But as we've been talking about, those seemingly minor things, they can be a sign of something bigger going on.
Yeah, absolutely. So if you're listening to this and something is resonating with you, like maybe you've been brushing off a symptom or just assuming it's no big deal, remember what Dr. Katsevman said. Don't self-diagnose. Go talk to a professional. I mean, it could be nothing, but wouldn't you rather know for sure?
100%. Knowledge is power, especially when it comes to your health.
Well said. Okay, folks, that was an incredible deep dive into the world of neurosurgery. I know I learned a ton. Turns out it's a much broader, much more fascinating field than I think a lot of us realize.
For sure. I mean, it really makes you appreciate just how complex, how amazing our bodies really are.
Right, especially our nervous systems. This incredible network that lets us experience, well, everything is something we just take for granted, but it really is a marvel.
Totally agree.
So if you, our amazing listener, take away just one thing from this deep dive, let it be this. Your body is always talking to you. Pay attention to what it's saying, and never hesitate to reach out for help when you need it. Until next time, keep exploring, keep asking those curious questions, and keep those amazing brains of yours buzzing.